April is dedicated to raising awareness of organ donations and minority health. African Americans are 3 times more likely than whites to develop kidney disease. The #1 cause is diabetes. The National Kidney Foundation launched a public service announcement this month about blacks and kidney disease and the need for organ donors. Take a look.
Kidney disease impacts people's lives in a way that's unimaginable. My mother was on dialysis for several years. It completely changed the way she lived.
African Americans are 3 to 4 times more likely to progress to end-stage renal disease from chronic kidney disease compared to Caucasians. For many African Americans, they will be told that they will need to stay on dialysis for the rest of their life, and that is not true.
We just didn't know that it was an option to be able to donate. It really didn't change much for me, but it changed so much for the person that I gave the kidney to.
Even on that first day, they look different and they feel different.
The impact that kidney disease has on people's life doesn't have to be the end of the story. If you or a loved one is suffering from kidney disease or kidney failure, I highly encourage you to contact your doctor to find out more about living donation or go to kidney.org.
Joining me now are Sam Shapinski from the National Kidney Foundation of Michigan and Nikki Bryant, a kidney disease patient and peer mentor at the foundation. Welcome both of you to American Black Journal.
Thank you for having us.
Thank you.
Sam, let's start with the numbers that I was just talking about there. 3 times more likely to develop kidney disease. What are some of the reasons for that? I mean, we see different and disparate impacts, health impacts on African Americans in many different areas. What's the driver here?
Well, there are a number of different factors that disproportionately affect minorities and especially African Americans. We know that 70% of kidney disease is caused by diabetes and hypertension, which are both preventable, and African Americans suffer that at much higher rates than other racial groups, and especially Caucasians.
Yeah. And this idea that you don't have to sort of suffer with kidney disease and dialysis, the disruption of dialysis for the rest of your life, there's a sort of a cultural disconnect that I think prevents a lot of African Americans from understanding that and then pursuing it.
A lot of, especially African Americans, they don't just find out that they have kidney disease until later stages, and so the complications that kind of snowball with that from late detection make it a lot harder, and some of that relates to access to care and some preconceived notions that a lot of people have towards what care will be like.
Yeah. Nikki, tell us about your story.
So I started out finding out that I had kidney disease as a young teenager. I was having some flu-like symptoms. My mom came home and took me to the ER, and we found out that my numbers were all over the place. And
when you say numbers, what are those numbers?
So the factors are for kidney disease is like your creatinine, your GFR, which kind of is a number that lets you know the toxicities in your body, how your kidney's functioning at what percentage. Those were all off the charts. So then they had told us that I was in kidney failure.
And so what did the treatment look like for you as a child?
Yeah, so as a young person coming into it with an illness, they right away had to put a catheter in my chest, so that way there would be some access for me to get the dialysis that I needed. So as a teenager, you're already going through body images as is, and then to have some foreign object really on top of that, it was very scary. It was really hard to take in.
And dialysis led to what?
So my dialysis was from a rare kidney disease called Goodpasture syndrome. It's an autoimmune disease, family's lupus. And that's how I fell into that. The type of Goodpastures that I have, it was very rare at that time, so there wasn't a lot of information on it. They just knew that they needed to get my blood clean and I needed to start dialysis right away. So that's...
you're a kidney ambassador for the foundation, which entails, reaching out to people.
Yes.
Who might not be on top of their health. In your case, though, this was something that developed when you were a child. I mean,
Yes.
that's an entirely different kind of issue.
Yes. With that being said, though, dialysis is still the same, whether I had an autoimmune disease or it was something that, could have been prevented. That's why I think it's so important to get in the community and let people know that diet and exercise is just such a key, because getting to the point where you're at dialysis is just such a lifestyle change. And a lot of people are not very accepting and willing to follow, but if you could do something to prevent it at the beginning.
Talk about some of the symptoms that people should be aware of that would say, hey, I should probably see my doctor and ask about whether this is kidney disease.
Well, early on, the early stages a lot of people are asymptomatic. And it's often towards the later stages where things like diabetes and hypertension come up that there is some indication that someone is going into later stages of kidney disease. They're the things that we hear more about, increased thirst, but the complications of diabetes and hypertension with high sugars, low sugars, high blood pressure people can experience kind of flu-like symptoms and a number of things that may not be super specific. So that's why we really encourage everyone to be in stronger contact with their primary care, with their healthcare providers. So some of the symptoms which may not be definitive can be still caught.
Sure. Often in the African American community, there's an issue not just with going to the physician regularly, but having a physician who is aware and aggressive about pointing out the things that you need to be aware of.
Yeah, very, very much so. Fortunately now, with the GFR test is much more common if you are going for an annual physical. It's a regular test in a blood test, and it can help us detect at earlier stages. Other types of screenings, community-based screenings, have some impact. There are a lot of other ways to start to educate ourselves to find out how to do that. And the Kidney Foundation is involved with that. We work with community groups like churches. Very recently, March was National Kidney Month, so we partnered with Fellowship Chapel in Northwest Detroit to offer a kidney screening with other partners in the area.
If there's one thing you could say to people out there about what they should know, what they should be looking for in terms of being that sort of ambassador, what would that be?
The one thing people always say to me when they meet me is, you do not look sick. And I want people to know that this is what kidney disease looks like. It doesn't discriminate. It has no, finger pointing. It affects us all. And dialysis is really hard. It's really taxing. You are told what you can and can't eat, how much you can and can't drink. There's so many factors in it that just throws off your normal lifestyle. And if someone could get tested, go to the doctor, have them check for their kidney function, just be more alert of what you're putting in your body. Get up. It's starting to get nice out, hopefully for Michigan. We can get out and get some exercise, and I strongly encourage that of all ages, everything.
Okay. Congratulations on the work, and thanks both of you
Thank you
for being here.
Thank you.